everyone, welcome back to another episode of the Breast Cancer Physio. I am very, very excited today because this is the wonderful Fiona Rogers, our women's health physiotherapist, and Fiona is my very first guest on my channel. So I can't believe this is actually happening today because this has been a long-term plan in the making. So I'll let Fiona introduce herself and tell us a bit about your background.
Thanks for having me, Jen. It's really exciting to be number one. I'm a women's health physio. I've been a physio for many years, and in the last sort of 20 years I've really focused on women's health, so and particularly pelvic floor function. So through that, I actually also run a company called Pelvic Floor Exercise that we sell pelvic floor rehab devices online, and I teach courses to other physios as well related to that area. And Jen and I actually go back quite some years.
A long
worked
time
together.
we do, yes.
And then we were both working in different places, and I think the universe has brought us back together again.
Absolutely.
So I'm doing a little bit of pelvic floor, seeing patients with pelvic floor issues at Jen's clinic, and mainly to work with her ladies who've been through breast cancer, because I think a lot of women really have no idea when they've had breast cancer and they've been through treatment, that quite often they're left with pelvic floor dysfunction, and it's not something that's talked about. It's not something that you expect, and it can be very distressing when in fact, if we can get onto it really quickly or educate people about it, then quite often we can avoid those problems, or we can certainly manage them.
Absolutely. And I think one of the things I love about what you and I get to do is that we can empower women in very dire straight situations, really, when it comes to their mental and physical health. And obviously the topic we're talking about today is it's quite near and dear to my heart, in the sense that it's totally out of my scope. I don't treat pelvic floor issues, I don't treat sexual health issues, but the number of conversations I end up having with my patients about sexual health when it's in the context of breast cancer is huge. It's every single day sometimes. And so the ability for me to work with you, Fiona, has just been an absolute godsend, because to be able to reassure these women that within our clinic we can send them directly to someone who specialises in this area. And I would implore any physiotherapists who are working in lymphedema or breast cancer to connect yourself with a women's health physiotherapist, because I think one of the biggest problems with breast cancer is the whole focus is from the belly button up, when there is so much stuff that happens to the female downstairs. And I know we've discussed before that there is actually research that's been done on the fact that there is evidence to suggest that there's not enough discussion from medical professionals about the topics of sexual health or sexual health problems with their patients. That's correct, is
Absolutely.
it?
And I think sometimes there's not time for that conversation as well. And when you're going through breast cancer treatment, the focus is obviously very much on what's the next treatment, let's get you through to the next stage, and it seems to be stage by stage, and which is obviously how it has to be. But there's often not time for those conversations, and then, as you know, women sort of get to the end of their treatment and often literally fall out off the end, and there's still all these issues that need to be discussed, which is why I'm so excited working with you and with the Thrivership program, is that we can educate ladies, and even if they're not ready at the time to address it, at least they know. And I think that's my big passion, is letting women know that there are answers. So if you do come across these issues, you know that it is something that does happen to women. You're not alone, and there is something that we can do.
Yeah, absolutely. I think the thing I like preaching the most as well is to really empower women, encourage women to address the symptoms they are struggling with, because women are seemingly fantastic at putting a lot of symptoms aside. They're very caring by nature. That's in our DNA, to look after everyone else except ourselves. So we tend to go, I'll address that later. Someone else is worse off than me. It can't be that bad. I'm probably the only person in the universe with this going on, and no one can solve it. So that's a really common theme I see. So the topic we're going to discuss today, guys, is interestingly around breathing, but in the context of pelvic floor tension. Now, there might be some viewers that are watching this video going, what are you guys even talking about? Because it's actually quite common that women are not even informed that this can happen after breast cancer. We'll just put a little caveat here though, guys, and just mention that we are more specifically talking about this topic in the context of women who have had an estrogen positive breast cancer, because the topic we're going to discuss here more normally occurs in the situation where if you've had an estrogen positive breast cancer and then estrogen is essentially removed from your system, so to speak, by hormone blocking medication, that the ramifications of the estrogen being removed is what causes the pelvic floor tension. So I'll hand this point over to you, Fiona, because this is obviously your baby.
And I'll go with another caveat that this can actually happen to any woman, and particularly menopausal women and even postnatal women. So what happens is if you're put onto estrogen blockers, they're blocking your production of estrogen, which essentially puts you into a chemically induced menopause. So depending on your age and where you are in your own menopause or hormonal history, so for some women who go through breast cancer treatment after they've been through menopause, they're not going to be producing very much estrogen anyway, and they may have been used to these symptoms, vaginal dryness, hot flushes and so forth. But they will often still be put onto estrogen blockers to ensure that there's no estrogen to feed the tumours. Some women will be in that group of sort of 10 years before that, where we're in perimenopause, which is the gradual progression towards menopause, so your estrogen levels are already starting to decrease, and again they may be used to some of those symptoms happening.
It reminds me a little bit of if you've had a baby, it's if you go into labour naturally versus being induced. Sometimes in induction it's just like boom, we're in.
Yeah, absolutely.
Yeah, so.
And then if you're younger and your hormonal status is quite at that normal level to be reproductive years, then it can be quite a shock to be suddenly, and it's quite literally as soon as the medication starts to work, you're basically in a chemically induced menopause. And one of the things with that is what estrogen does, it nourishes our tissues. So, and if we think of the vagina, the mucosal walls of the vagina are very much like the inside of the mouth. So if you imagine getting a dry mouth, when you're not producing enough estrogen or any estrogen, those mucosal tissues can become very dry. And what happens then, if you attempt to have any sort of sexual intercourse or a sexual penetration of any sort, even
plain old masturbation.
Anything.
Yeah. Or pap smears, as we've discussed.
Pap
as
smears
well.
is another one, yeah. So you may find it very uncomfortable. So and what your pelvic floor muscles are aimed at doing, I've actually brought my pelvis here with me.
Fiona's brought some fantastic props today, guys. I'm very happy about this because props are great.
Have a little look. There's two layers to the pelvic floor. We've got the external layer, we've got the anus, vagina and urethra here, and then we've got a deeper layer of the pelvic floor. And these muscles around the opening to the vagina are actually like a circular muscle, and they're protective. So if you have a very dry vagina and you attempt to either have a pap smear or penetration of any sort, those muscles are going to clamp up and go, no,
thank you.
No, yeah. And the brain's very clever at remembering, very protective of you. So if you then repeatedly try to do that activity, the muscles can become quite tense, much like, when you get a tension headache. You don't purposely tense those muscles in your neck up, just like we don't purposely tension these muscles up, but they can over time become tighter. And I think too, just from the psychological effects of having had treatment and being through such a life-changing experience, we can actually just generally have overall body tension.
Absolutely, yeah. Which is why you and I wanted to pick this topic really first, because we thought, well, goodness, there's so many sexual health topics, pelvic health topics we could do. We really thought this was a great one to start with for you guys, because we do believe this is an incredibly under-addressed topic. But then also that breathing is something if you know how to influence your own breathing, which then influences your own anxiety levels, that's such a lovely flow-on effect for breast cancer survivors.
Yeah.
So, yeah.
And that links in very much to any sort of counselling and mindfulness sort of activities that you might be doing.
And the good news is as well is that we've got Julie Bolton, our breast cancer counsellor, on next week, and certainly we'll be talking about, the psychological effects of breast cancer. But I think, we'll probably end up doing a 3-panel video one day, because the psychological impacts of tissue tension, particularly when it's your pelvic floor, is just, it's mega, like it's a mega topic, it's so deep.
Absolutely. And that's a big flow on from what we'll talk about today, and things like using lubricants and so forth. So there's lots of things that we can do, but let's start with I always get a bit excited about this, because there's all these things I need to talk about, and when I'm having a consult with a patient, it takes us a good hour to go through all of that and through all of the steps that we can do. But starting with breathing is a really good thing. So basically the muscle that helps us to breathe is our diaphragm, and I have another little prop over here.
We've got a new prop again.
So this is basically what we look like internally, and here are the lungs here. Now, sitting just below the base of the lungs is a muscle called the diaphragm, and the diaphragm is actually a dome-shaped muscle. And when we breathe in, it shortens and tightens, and that helps to create a negative pressure that helps to suck the air into the lungs. But as it comes down, it pushes on all the abdominal contents, which gently pushes down onto the pelvic floor. When we breathe out, our diaphragm lengthens and comes up, which is part of helping to exhale. So it's a little bit more scientific than that, but that's essentially, in a nutshell. And that reduces the tension on the pelvic floor down here. And basically what happens is we should be getting a nice breathing in and out. And part of that, what that does is also massages the abdominal contents. So it actually helps with preventing constipation and that sort of thing. I know a lot of ladies find that when they're on these medications, they do become quite constipated, and that's another whole story we could do a session on for sure.
We'll do that one as well.
So even us sitting here breathing normally, Jen, we're not aware of it, but that diaphragm's coming down, we're getting some movement down onto our abdominal contents, and there's a gentle stretch on the pelvic floor, and then it releases and up. So if I then take a big deep breath, it pushes down even more, and that's what we use to try and help relax and lengthen the pelvic floor. So if I've examined someone who's very tense in the pelvic floor, and again, that's somewhere where we do hold a lot of tension, aside from having had an experience of pain when you're having any sort of penetration, it can be at any time that we can hold tension there. So the breathing can help for anybody, really. So what we're aiming to do with that is to do nice, big, slow, deep breaths so that we're getting a bit more of a stretch on the pelvic floor. Women who have had children and women who've been through menopause already will some people may have a prolapse or have issues with bladder and bowel control. And that's another driver for a lot of tension in the area.
That's interesting to say
that. They don't want to let go, and the other...
I thought you were actually going to say the opposite then. I actually thought that was going to be the other end of the spectrum, but what you're saying, that makes complete sense. It's like they realise there's laxity there and that's not a good thing.
So they don't like to relax and do it.
Gotcha.
And then the third part of this is basically your abdominal wall. So if we're going to get a nice, big, deep, relaxed breath, we also need to let our tummy go. And one of my favourite sayings with my ladies is, the wheel will not stop spinning if you let go. Okay? Because, because we all want to hold, the old thing about posture and holding our tummy in and looking slim and all those things that we're so ingrained that it's so bad for us. We need to be able to let go of the abdominals. And if you just try it yourself, if you clench your tummy, you will actually feel your pelvic floor tighten somewhat. And if you let your tummy go, you'll feel a gentle relaxation because your abdominal wall works with your pelvic floor, which works with your diaphragm. So it's like an internal canister, and sometimes it's called your core. And we're very core obsessed, and there's so many bad cues about your core out there, like sucking your belly button to your spine. But if you do that, you suck it in, you've already just breathed in and you're pushing down, and then you're trying to, if you're trying to lift your pelvic floor, it can be quite confusing. And so what I get my ladies to do, what I will normally notice, I'll pop a hand on their belly and a hand on their chest, and I'll say, just take a deep breath.
We'll do it together, actually, because I always find this fascinating, because I think, anyone can benefit from this. So even if, like we were talking before we started the video about if you've had a triple negative breast cancer, you may not have had estrogen as part of the driver towards your breast cancer. But there's a hell of a lot of stress and tension that occurs for breast cancer patients. So I think anyone's going to benefit from doing this activity.
Yeah. So what we would normally see, I'll tell a lady to now take a big deep breath, and what I will generally see is this.
Yeah, so what we saw there is like Fiona's top hand moved and nothing happened on the bottom.
Yeah. So and you'll see my shoulders have probably come up a little bit, because that's the way of tension breathing. And if you clench your abdominals and try to take a deep breath, I'm exaggerating it a bit here, but just to give the idea. Now let your abdominals go, just let it flop, okay? And now try to take what we call a belly breath. So what we're trying to do is get the bottom hand to rise before the top hand. Now, the air, when you breathe in, the air does not go into your belly, okay? It stays in your lungs. But if we've relaxed our belly, as we take that deep breath down into the base of the lungs, the belly should rise out a little bit first. So what we're aiming for is...
It's funny to do it because it actually makes you relax as you do it straight away.
And that affects your vagal nerve, and vagal nerve is the driver for a lot of the stress and cortisol, etc. So it's just letting go of your belly and a slow deep breath, aiming to expand at the waist there.
Yeah.
So people sometimes call this diaphragmatic breathing. I have a bit of an issue with that because you can't breathe if you don't use your diaphragm. But it's more what we call a basal breath. So the other way you can do it is pop your hands on either side of the lower rib cage, because your lungs actually come down to here. Your lungs, a lot of people don't realise, actually come up just above your collarbone.
Yep.
So that's where we get that upper... but you're using your chest and your shoulder muscles to lift, where we want that nice and relaxed, so the air comes out and in down here. So as if I do a proper belly breath, big, slow, deep breath in, I'm actually forcing the relaxation of my pelvic floor, but in a very gentle way. So it's just getting used to that sensation of letting go. Big, slow, deep breath. And your first benefit will be stress relief. It's will trigger your vagal nerve, which is really, what's involved a lot with the stress response, the fight and flight response. And when we're living in all these months of treatment, where you're in a high stress situation for most of it, and there's always, in the back of your mind, is it coming back? Is it, am I going to be sick? What's happening here? We're living in a
heightened state.
Yeah, absolutely.
And I think that's what Julie Lawton and I are actually going to touch on as our first topic next week. So that'll be a really good flow on from this video, guys, is that we're going to be discussing essentially like what happens to your body when you're in that heightened state, and obviously this is just part of it.
Yeah.
So
and muscle tension is one of those things. So it's such a simple thing to do that just learn it, but it can be very difficult for some people. And even just trying to do a big deep breath can actually almost trigger a bit of anxiety in some people. So if that's happening, again, touch is very good. So just doing it to yourself, just some firm placement of the hands, and just trying to go a little bit deeper. A little bit deeper.
As in take a bigger breath.
So start with a normal breath and then go a little bit deeper, and then build up over, say, 3 breaths to get that nice big breath. But you've got to let that tummy go. And one of the other things is we're probably doing it a bit here, when as ladies we're taught to sit all prim and proper, is actually...
Sit like a bloke.
Sit like a bloke. One of my colleagues actually talks about this, and she said, just, take up space. And, you don't have to do it out in public, but just sort of sitting at home, you feel comfortable, and that way you can just let it all go. And then try some big, slow, deep breaths. Good place to do it is lying down lying down with your knees bent up, nice and relaxed, hands on your belly to start with, and some slow, deep breaths. It's one of those things you can do anywhere, anytime. And it can help relax the pelvic floor as well, which is obviously what one of the aims for me teaching it. And there's all the other factors, like you're using a lubricant and so forth, which we're going to talk about
and we'll cover
later.
These topics as well, guys, in other videos. Obviously, this is sort of step number 1, and I'm assuming this is the first step you take with any of your patients, Fiona, who have this pelvic floor tension from essentially chemically induced pelvic floor tension from hormone blocking medication is the main, driver where this is caused. But yeah, we will go on
Yep.
to do videos on, you know, vaginal dilators and all of the other tricks of the trade that
Yep.
you can,
This,
that you
you
can
know,
incorporate.
Absolutely.
This
And-
won't solve it by itself, essentially, is what we're saying.
Well, that's right. But
Yeah.
this is step one, and this is something you can do anywhere, anytime. So the signs to you that you may have an issue with pelvic floor tension can be, obviously, you know, if you're having pain with any form of penetration, and that may be with a sex toy. It could be penetrative intercourse. It could be when you go to have a pap smear. Trouble with your bladder or bowel. So if you're having trouble emptying, it can be a sign that the pelvic floor
Is too tight.
can be too tight.
Yeah.
And any pain in that, and sometimes it'll manifest as something like tailbone pain. So sitting can be uncomfortable because your pelvic floor, the deep layer of the pelvic floor, actually attaches to the tailbone. So any tension or ongoing tension in that pelvic floor can give you pain around the tailbone. It can give you pain in the pudendal nerve. So you may be getting that sort of around the genital area, and sometimes on what we call our sit bones through those areas. So the pudendal nerve can be affected, and you know it can be like a bit of a
There's quite a few symptoms
Yeah,
there.
yeah.
It's really fascinating hearing all of this, because I know you and I have talked about this ad nauseum on a number of occasions. But as a sort of a cross example, a lot of women discuss that after lumpectomy radiation, going back for a mammogram can be painful because of the effect of the surgical and the radiation scarring on the breast. So in the same way that it's like, oh geez, we've now got to go back for a pap smear, but my vagina is literally too tight to get the pap smear. It's like now we've got, you know, the same thing happening on the front of a mammogram, you know, to check for occurrences and whatnot. There's a lot of cross sort of themes coming in here into my head. So,
And I think too, because we just think of it's breast cancer, it's up here. What the heck's it got to do with my, you know, my vagina and my pelvic floor? And quite frankly, a lot of women have no idea about their pelvic floor until something goes wrong. Or so, you know, it can be almost like a double shock. That something's going
absolutely
wrong.
And I must give a shout out to one of our mutual patients, Rhonda, because she actually inspired this video, because this is a patient who approached me about this topic. In actual fact, no, that's wrong. I was discussing this topic with her because I make a point sometimes of bringing up concepts around sexual health, because not that I treat it, but because so many women are uninformed about it, I just make a point of sort of crowbarring it into the conversation. And and this is how this video came about, really, as a topic. So thank you to Rhonda, who knows who she is. So on that note, Fiona, if people want more information, or how can they actually get more info from you, or what's out there that can learn about like pelvic floor tension?
Well, if you're on the coast, you can come and see me as a patient. I've got some resources on my website, pelvicfloorexercise.com.au. But my main advice would be, if you feel something like this is happening, find an experienced pelvic floor physio near where you are, and just go and have an assessment and chat to them and say, you know, you think that this is going on, or you'd like to know more. And that's why I think it's great, you know, working in a multidisciplinary team like we do, or even though we're both physios, we've got our skill set. So you know, Jen will often ask me to see one of her ladies, and quite often it's a one-off or one or two sessions just to get things on track. And then we sort of hand patients backwards and forwards.
And I think that's a really good point too. Sometimes some of the issues, and it's not just related to sexual health necessarily, you might only need 1 to 2 sessions with an experienced allied health professional. All of a sudden that problem is out of your life, and it is so unbelievably relieving for the patient. And even if you can't necessarily do all the treatment sessions you want in one hit, or it's going to take a bit of time to chip away at it, the fact that there's a resolution to that problem is like the most important thing for the patient, I believe.
And 90% of what I do is I don't do things to my patients. I educate them. This is what's happening. This is how we can work on it. And it's tools that you can do at home. So, you know, you might need to use dilators, you might need to use some lubricant, you might need to do some breathing, stretching. Pelvic girdle stretching is another huge thing. And that helps with the pelvic floor down training as well. So, you know, maybe doing a video sometime on all those
We've got a lot of videos to do.
If anyone's familiar with child's pose, with yoga and doing it with the toes together and the knees apart and just gently resting your forehead on your hands, and just letting everything go, and then doing some breathing in those positions is such a beautiful stretch overall. So there's loads and loads of things to do. So I just sort of set the program up and say, well, these are the things that we can do. And normally I'll say, you know, where do you think you can start now? Because I think patient fatigue, as in treatment fatigue, is a massive thing.
So true.
And by the time I find ladies get to me, because I've been through all of their treatment and now we've identified that this is an issue, they're just so sick and tired.
Yeah, they're over it.
They're over it.
Yeah.
So my approach tends to be, well, you know, these are the things that can help. What do you think you can incorporate? Let's start with one thing at a time.
Yeah. I think that's a really fantastic way to go, because some people can take on more than others at times.
Absolutely.
But it's such an important way. It's a thing to consider for the health professional, because I think we can easily overload our patients.
Oh, absolutely.
Hence why we'll wrap this video up now, probably, because otherwise we'll overload you. And Fiona's definitely going to come back and join me for more videos. So please shoot your questions through to me. I'm sure Fiona will be happy to continue the conversation on this topic. So just remember that if you have enjoyed this video, guys, and you would like to see more, then please consider subscribing to my channel, which is completely free. Give it a big thumbs up, hit the like down below, and if you do have a question, just leave a comment in the section below. I'll leave Fiona's website link in the description bar, and we'll probably have a little bar that pops up for a link as well here to her website. So shoot them through if you've got questions, and we will see you back here next week for another video. Thank you very much for watching. I'm Jen McKenzie, the Breast Cancer Physio, and we'll see you next time.